Hello and welcome back to the CNS Pharmacology Masterclass. Here we will talk about the heroin. It's another opioid analgesic. So first, let's talk about where the heroin sits in relation with other opioids. So regarding opioids, we have the natural, the semi-synthetic, and the synthetic opioids, and the heroin is included in the semi-synthetic opioids. So heroin is a trade name for a drug that is called diacetylmorphine or dimorphine or acetylated morphine, and it is a semi-synthetic opioid as we mentioned. Heroin is used medically in several countries to relieve pain, which is analgesic, but it is banned in most countries because of the highly addictive properties of this drug. It is used illegally for recreational use due to the euphoria it induces, and that is what it's famous for. Let's talk about the history of this drug. So it is first synthesized in 1874 by Carlos Alder Wright, which is an English chemist, but the invention didn't lead to any further developments, and it is resynthesized again in 1897 by Felix Hoffmann, who is a German chemist, and the heroin marketed initially as an over-the-counter drug for cough suppression to replace the addictive morphine. So this is the original advertisement for morphine. Bayer is the pharmaceutical company that produced this drug, and they also produced the aspirin at the time and the heroin too, which advertised it as sedative for coughs. And soon in 1910, heroin had one of the highest addiction among its users. So it was the opposite to being non-addictive. It was very highly addictive. It is much worse than the morphine, and that is why in 1924 United States banned heroin from being used. So let's talk about the pharmacokinetics of this drug. So regarding administration, it is available as oral, intravenous formulas, which are the most common formulas used in medicine. Regarding absorption, the oral form is very well absorbed because it is highly lipid soluble, and which then undergoes extensive first pass effect via deacetylation to be converted to morphine. So after it gets absorbed, it gets into the portal vein and into the liver, where it will be metabolized extensively by the first pass effect by deacetylation to become morphine again. And it is distributed quickly to tissues, especially the brain, and it is metabolized by the liver and excreted through the kidney and liver. Regarding the mechanism of action of the heroin, it works on the opioid receptors, which are three major receptors, the mu, the delta, and kappa, and they are available everywhere in the human body, especially in the central nervous system. Regarding the pharmacological effects, the heroin produces greater pharmacological effects than the morphine does. So activation of these opioid receptors by heroin lead to several central effects, which include the analgesia, the analgesic properties of the heroin. It will produce sensory and emotional analgesia, which is better than the morphine analgesia. It would also produce euphoria, which is also better than the morphine, sedation. It also produces respiratory depression, cough suppression, which is the property that is advertised for initially in 1898, and it would lead to meiosis, which is pupil constriction due to its vagal stimulations, and it would lead to nausea and vomiting because it activates the chemoreceptor trigger zone in the brainstem, and it would also lead to pruritus because it leads to heavy histamine release, which is more histamine release than with the morphine. And activation of these opioid receptors would also lead to several peripheral effects, including effects on the cardiovascular system in form of bradycardia and hypotension, and also effects on the GIT system in form of constipation, respiratory system in form of bronchoconstriction, urinary system in form of bladder constriction and urethral constriction, endocrine system by increasing the luteinizing hormone and somatotropin, and the immune system, which lead to decreased immunity by inhibiting the lymphocytes. So those are the effects of the heroin included in a picture. So here we have the short-term effects and here the long-term effects. So the short-term effects include the central effects, which are the euphoria and alternately alert and drowsy state, which is the sedation. In the mouth, it leads to dryness. In the skin, it leads to warm flushing of the skin because of the histamine release. And regarding the respiratory system, it leads to slowed breathing due to the inhibition of the respiratory center. And regarding the muscular, it leads to weakness. The long-term effects is the addiction, the tolerance, and the dependence, which we will talk about in the adverse effects slides, which comes next. And regarding the respiratory system, it might lead to pneumonia because it decreases immunity. And regarding the heart, it leads to infection of the heart lining and valves. Regarding the circulatory system, it leads to collapsed veins. Regarding the liver, it leads to decreased function of the liver, and it might lead to abscesses formation. Now let's talk about the adverse effects of the heroin. So it leads to tolerance. Tolerance means that with recurrent use of the heroin, there would be physiological adaptation to heroin. This would lead to physiological adaptation and receptor upregulation, which lead to the same dose of heroin making less effect. And that is why the user tries to increase the dose to produce the same effect having with the last dose. And that's what we mean by tolerance. The other adverse effect to heroin is the physical dependence, meaning the person uses heroin become physically dependent to the heroin because of the physiological adaptation and the neurotransmitter changes. And that means when that person stops heroin suddenly, this would lead to withdrawal syndrome. Heroin also leads to psychological dependence, which is also called addiction, which is changes in the person who uses this drug behavior and memory. And all of these effects are worse in heroin users than the morphine users. The other adverse effect heroin causes is regarding the respiratory system. It leads to bronchoconstriction that we mentioned earlier due to histamine release. Regarding cardiovascular system, it leads to postural hypotension and bradycardia. Regarding the GIT system, it leads to nausea, vomiting, constipation, and biliary colic. Regarding the urinary system, it may lead to urine retention due to detrusor muscle activation, especially in patients with benign prostatic hyperplasia. And in the eye, it leads to miosis, and miosis is a consistent feature in all heroin addicts. And with that, we reach the end of this video. Thank you guys for watching. Please like this video so it reaches more people, and peace.